The skin rashes I'm going to talk about, the oral dermatoses, in order of decrease in incidence, listed here below, with by far the most common being lichen planus, and I'm going to spend most time on that. But also these others here listed: mucous membrane pemphigoid, pemphigus, and erythema multiforme, and lupus erythematosus. And then just a quick mention of this one down here. So first of all, lichen planus. Now, half my clinical practice is filled with these patients, and we see an awful lot of biopsies in the diagnostic service of lichen planus. It's a common chronic inflammatory disease of the skin and or the mucous membranes. So generally, it's the skin or the mouth which we see most commonly, either or both. Generally, about 30% of people can get both skin and oral mucosal involvement, and that may not be at the same time. It might be separated by even quite a few years. For example, I saw a patient yesterday who's for oral lichen planus, and this lady had been diagnosed with skin lichen planus 30 years ago. It had recurred again on the skin 10 years ago, and now she's presented with oral lichen planus. So it really is a chronic disease. You can more uncommonly get involvement of the oropharynx, the genital mucosa, and the nails. And in my experience, usually the involvement that I've seen is the genital mucosa, and these patients I think really need to be referred. They're in quite a lot of discomfort, and to a dermatologist who has a special interest in this area. As I said, it's quite common. It affects 1 to 2% of the population. What causes it? We don't know. It's not strictly an autoimmune disease. A lot of people look this up on the web and they say it's an autoimmune disease. It's not. It's not associated with any other autoimmune disease, and it's not associated with any other medical disease. It's not going to give these patients hypertension or inflammatory bowel disease. It is immunologically mediated, and that's where you get the damage to the epithelium. We don't know what the antigen is, but I'll show you some pictures in a few slides which will show you the histology, which shows you where the damage is. So that's by far the most common presentation. We just don't know. Now, in the literature, you'll see, or you may have heard, people talk about lichenoid reactions. So lichenoid drug reactions are quite well recognized, and some people get a lichenoid reaction to non-steroidal anti-inflammatory medications, some antihypertensive medication, angiotensin-converting enzyme inhibitors, Xyloprim for gout, or some of the oral hypoglycemics. So you do need to be aware of that. Those reactions need to be temporally, so in time with really the patient taking the medication and then developing the oral mucosal manifestations. And it'll really generally be quite widespread. It'll be quite sore, quite erythematous, and quite ulcerative.